Good morning, everyone. I want to welcome everyone to Han's annual policy, both those in the room and those joining us virtually. My name is Dave Zuckerman. I'm president and founder of the Healthcare Anchor Network. And we've been hosting this event for nearly a decade. And it remains one of our most important strategies for driving change at the systems and sector level. And our purpose today is clear. We want to make the case for federal investment in affordable housing and workforce development and make it powerful. I'll share a few more remarks about that in a bit, but we are joined already by Congressman Jim McGovern, and I wanted to give him some time to share more about his passion for this work. He has been the sponsor of this event really from the beginning. We are deeply grateful for his support, and also that of UMass Memorial Health, who's been a very active HAN member, a co-founding member of the Healthcare Anchor Network, helping us connect us to Congressman McGovern. Congressman McGovern is a passionate advocate for anti-hunger. He's been a champion of addressing the social drivers of poor health upstream. So I want to welcome the Congressman to share a few words.
Well, let me thank Dave for the generous introduction for all that he does. Good morning, everybody. And I want to thank the Healthcare Anchor Network and UMass Memorial Health for inviting me. I also want to thank Big Bam for all that you do to organize these events, and it's great to be with everybody. Somebody asked me on the way in, how are things going? And I didn't have an answer. About a year and a half ago, I was in India, and I met His Holiness the Dalai Lama as he was approaching his 90th birthday. And he gave me these prayer beads that I wear all the time. And he told me, he blessed them, and he told me that they're there for to help me deal with my negativity and my anguish and my concerns and my fears. And so I wear them all the time, and I'm anxious to see them again soon so I can tell them they don't work. This, for a lot of the issues that people here care about, this is a really challenging time. I'm consistently impressed by the work the Healthcare Anchor Network and its members do to address social determinants of health. You all recognize how incredibly important it is to ensure that every person, regardless of their income, has access to healthcare. Healthcare is a basic fundamental human right. Affordability challenges don't occur in silos. About 1 in 4 renters spend over half of their income on rent. That means that more than 11 million households, families don't have enough to cover the basic needs like food and medicine. People have to, make choices. Republicans cut SNAP, the Supplemental Nutrition Assistance Program, by almost $200 billion last summer. That's billion with a B. And by the way, that's a benefit that on average is about $2 per person per meal. We ought to be talking about how you expand that benefit, not how you cut it. And next week, the House is expected to consider a farm bill on the House floor, and that will lock in these devastating cuts for the next 5 years. And we're told that there's a reconciliation bill that's going to follow, which will have even deeper cuts in food assistance. I don't know how you live without food. And we live in a country, the richest country in the history of the world. There are 46 million Americans that are hungry or food insecure, and we should be ashamed of that. But millions are going to lose what little support they have, which means even more people will be forced to make the impossible choice between feeding their kids, paying their rent, and refilling necessary prescriptions. When people cannot afford food or go to the doctor, their health suffers. That means sicker people and even more of a strain on our health system. Cutting healthcare, cutting food assistance, cutting kind of basic needs doesn't save you any money in the long run. People who don't have access to nutrition develop all kinds of health challenges as they get older. I was visiting an emergency room at one of my local hospitals, and I asked the doctor who was giving me a tour, tell me, what are people here for? And, 1,000 different things. But he said that a number of people are here, a lot of older people are here because they're taking their medication on an empty stomach because they can't afford the cost of their medication and basic food. I again keep on reminding myself that this is the United States of America. We are the richest country in the history of the world, and this is happening. But all around the country, our health systems are buckling under the weight of higher need patients. And due to the almost $1 trillion, trillion with a T, $1 trillion cut to Medicaid in HR1, they call it the big beautiful bill, I call it the big ugly bill. There is not a doubt in my mind that the pressure on our healthcare system is going to get much worse. Our healthcare workers are already burnt out. Our hospitals are facing significant workforce shortages that will only increase as more providers retire in coming years. And I know that the health systems represented at this event want to create career pathways to fill these desperately needed positions. An important part of that is supporting good immigration policy as well. Everything is interrelated. We are witnessing an all-out assault on immigrants, and the impact of this on the healthcare workforce around the country cannot be understated. From physicians to home health aides, healthcare workers come to the U.S. from all around the world and are critical to the functioning of our systems. I visited a nursing home facility in my district a few months ago. An incredible place, packed. There's not a vacancy. And I was told by the owner that a significant number of the workers there are Haitian immigrants who are here under temporary protected status. The president is trying to rip that status away from Haitian migrants in this country. And a court has, put a stay on it. House passed a bill actually to extend temporary protected status for Haitians. But he said if they lose that legal status, and I can't hire them, I will be in violation of the law. And if I don't have these workers, many of them trained nurses, I'm going to have to go to people who are here and their families that say that you can no longer remain here because we don't have the personnel to be able to accommodate everybody. And he says, and other challenges, there's not a line of people wanting to do this work. And so this is a real crisis that I don't think we talk nearly enough about when we talk about immigration. I know many of your institutions help implement local hiring programs, and I know that you know probably better than most that we cannot address our workforce challenge without addressing the issue of comprehensive immigration reform as well. And I think it's important to help tell the stories and the reality because so much of the discussion in this place is about BS, is about narratives that are false. And I think stories and just basic narratives of what the realities are that you are facing, I think can move people. But I think it is incredibly important that you're here today. It's crucial. You are healthcare advocates, but you're also housing advocates. You are workforce development advocates. You are anti-hunger advocates. You all recognize that a person's health is determined by much more than just the medication and the trips to the doctor's office. You know that people need roofs over their heads, good jobs, and affordable nutritious food in order to live well. You represent hospitals and healthcare systems around the country that understand this on a fundamental level, and your institutions are models in this fight. By helping people access housing, job training, and food, you are leading the way to how we address social determinants of health. And it is no secret that things haven't been so great in Congress this last year. But it matters that you are here. Not only is it uplifting to hear about the incredible work that you all do, but your unique experience and expertise is what will lead to real holistic policy solutions. Because I'll be honest with you, not enough people here understand how important the intersections of these issues are to a person's health. Now, I don't want to, and let me just say one thing. When you talk to members of Congress, everybody always talks about cost, and they talk about the money. We have to make tough choices. And one thing that always frustrates me is that too many members of Congress don't understand the connection between investing in preventative healthcare and actually saving money. I mean, it is a lot more expensive for me to treat you in an emergency room or when you have a full-blown illness that could have been prevented. And so investing early on, investing in personnel, making it easier and more affordable for people to have access to preventive care actually saves money. So if you care about controlling healthcare costs, we got to think about all this differently. I don't want to end on all doom and gloom, but one potential bright spot where I think Democrats and Republicans are trying to work together, we maybe might be able to get something done that's meaningful, is around food as medicine. We're late to this topic in this country. I don't know why, but we are. I have a bipartisan bill to create a pilot to ensure that more seniors are eligible to receive nutritious, medically tailored meals following a hospitalization or as part of a treatment for diet-related illness. The bill passed out of committee last year and we're working to try to get it passed into law this year. I share this just to say that despite the challenges we might face in the coming months and years, there are still opportunities to take meaningful action and positively affect people's lives. And I'm looking forward for any and every chance to do so. I'm a believer that you don't have to agree on everything to agree on something. And it's something we agree on. If it's good, let's come together and let's get it done. So again, I want to thank you all for your work. I want to thank you for all you do to expand access to housing, to invest in workforce development and promote policies that address social determinants of health. I look forward to continuing to work with you to improve access and outcomes for all. And the final thing I'm going to say, I really believe it is important that you are here in person. You know, sometimes when you wake up in the morning, you turn on the news, it's not one thing, it's not two things, it's like six things. And, you know, a lot of people feel overwhelmed and feel like the hell with it. I want to pull the shade, wake me up when it's over. And I think that's a deliberate strategy. You being here in person, it's hard to ignore the topics that you are bringing to the table. So just on a personal level, thanks for taking time out of your busy lives and coming here. I think this is important. We need to do a hell of a lot better in this country, and you're part of the way we're going to do better here. So thank you and have a good rest of your day. Thank you.
Oh, look at that.
So we are super excited to welcome Congress member Joyce Beatty, who's I believe joining us for Policy Day for the first time, which is super amazing. And she's a co-sponsor, one of the main co-sponsors of the Housing for the 21st Century Bill. And just wanted to really thank the member for joining us this morning. Congressman.
Thank you. You know, it's always a hard act to follow Jim McGovern, who is usually very funny, very explicit, and someone that I certainly enjoy working with. But first of all, let me just say thank you for inviting me here, and thank you for being interested in housing and asking me to address that. So first, let me just kind of set the stage for you. I want to tell you about where housing falls in our structure so we can give you that information. So there are 4 exclusive committees, and financial services is one of those committees. And I serve on that committee, and I've served on that committee ever since my freshman year, which is kind of rare. So let me tell you how that happened. And I'm going to be finished in my 5 minutes with this. So when you come in as a freshman, they give you a sheet of paper and have 1, 2, 3, sometimes 4 and 5. And they tell you to put your first, second, third, and fourth committees. Well, I knew I wanted to be on financial services because housing was in financial services, financial institutions, in banking, all the stuff that I really enjoyed. We don't have a healthcare on the House side that's over on the Senate, other than Ways and Means on the House side. So, being the talented, bright person I am, I decided to put financial services, financial services, financial services, financial services. That was my first, second, and third choice. Well, they didn't find that too funny as a freshman. So they posted then the list on the door of the committees. And there were 8 slots on financial services. And so I looked down the list, and Congresswoman Terry Sewell was in the 8th slot. So then I looked on all this, I didn't have a committee. So I have to go see the speaker and the House leader, and they said, well, what did you put down for your second and third choice? Financial services, financial services, financial services. So relationships are very important because they build partnership. I had a good relationship with the speaker, who happened to be from my hometown, from Ohio, from my home state, and Leader Pelosi, John Boehner, and Leader Pelosi was the House leader, who I had a good relationship as a dedicated member. So the next day, there was magically a 9th line, and there was Joyce Bailey. So I got on financial services and I got on housing, and that's why I told you that story. So I was so excited to be on housing. I had been a consultant for HUD and done a lot of housing work with public housing and doing relocation for almost some 14 or 15 years. So let's fast forward to where we are now. Because when I came into Congress at that time, housing was a big issue because we were still dealing with affordable housing, or the lack of affordable housing. We were dealing with so many pieces of legislation that dealt with everything from the home program to community development block grants. We were dealing with reducing public housing. Section 8 had wait lists of thousands of people in just about every state across the country. And so in this Congress, working with Congresswoman Maxine Waters, Congressman French Hill, and on that committee, there are close to, we had a vote yesterday, and it averaged from 27 to 28. So you have about 50 people if everybody shows up on the Financial Services Committee. And then we have the subcommittee of housing that we have a chairman, who's Congressman Flood, and then the ranking member is Congressman Cleaver. And it's a good blend. They're diverse in the states they represent and their backgrounds. And Sierra, who is a lawyer and staffs me on the committee, reminded me just this morning that they try not to have more than 2 members from each state. And so we cover about 11 states because, as I understand it, you're from across the United States here. So more than likely, as we look at these members from states that crisscross the United States, from Oklahoma to Texas to Kentucky to Indiana, South Carolina, Pennsylvania, California, New York, Iowa, Michigan, and did I say twice the great state of Ohio? And so that gives you some idea of the members and where they are from. And so we have 30 members who are Republican, and we have 24 members who are Democrat. So that sets the stage. And I tell you this because one of the things I'm going to ask you to do, if you're really interested in housing, is to make sure that you contact your member of Congress. And when you do that, tell them about this program today and tell them why you are interested in housing. Because what I can tell you, safe and stable and affordable housing directly impacts both the physical and mental health, your mental well-being. I mean, can you just imagine if you went back to your home tomorrow or the next day and there was an eviction notice? Or can you imagine that someone was calling you, the bank, about your mortgage? This happens every day because so often when you think about if someone's housing cost is 30% of their income, they're
probably gonna have to forego something. And you understand healthcare, and that's usually the first thing because of the cost. You've heard the stories that I can tell you are actually real, that people will say, I will wait till later to go get care. I'm just a little sick. Well, what's a little sick? Or I just have a little problem, or they end up in the emergency room because that would be free versus trying to go to their doctor. And so when you think about where we are with housing today, we understand that. So we came up with a bill called the 21st Century Road to Housing Act, or HR 6644. Now, and I'm going to tell you a little bit about that in the time I have left. And the reason I'm going to tell you that is to go back to that whole thing about structure. This is a bipartisan bill, meaning the Republicans and the Democrats came together and decided we do really have a housing problem. And so we decided that we would do this. And it's very important when you think about taking something to the House floor. It passed out of our committee. And that's a rare thing. And I hate to tell you this, we are in a very divided Congress right now. So to be able to get something that's as major as this, think about the people from all over the states. So I asked them to write this down so I'd get this right for me. It went on the United States House floor after it passed out of committee. 390 people voted for it, and there were only 9 people who voted against it. Trust me, that is a big deal that we were able to get that. So as you know, it goes from the House, it goes over to the Senate. The Senate took a look at it. They made some adjustments. We didn't like all of it, but they then voted 89-10 and to get it passed. But when you make some tweaks or some adjustments, it has to come back to the House for us then to take a look at that. And that's where we're at a stalemate. Because we're in a time that we need you more than ever. It's a time that we need you to say, for example, since you're interested in housing, what's up with this 21st Century Road to Housing Act? If it passed out with 390 people, the information is important, 390 people, and then it passed the Senate with 89 people, why can't we get this to come back to the floor? And why can't we do this? It has things from Democrats and Republicans in this bill. When the bill went over to the Senate, I had 5 different bills in it. When it came back, I still had bills in it. I have 3 bills in it. The banking people love the bill because we made an adjustment on the PWI, taking it from 15% to 20%, and that's a cap. So we raised the cap from 15% to 20%, so banks could invest more in affordable housing and community development projects. If I take my great state from Ohio, is anybody in here from Ohio? Oh, and I do. I love that. I'm on the front row. So let me just tell you, you hear it every day in a housing by us having the lack of affordable housing. In Ohio is facing a housing shortage of some 264,000 units. That's a lot of housing shortage. And so in this complete package, it includes some things that we don't like, and it includes some things that we do like. And you're not going to get a perfect world here, but here's what we know. This bill will help make a difference for us, and it's being held up. So if there's one thing I can ask of you, it would be to call your members and ask them to take a look at this. And here's the thing, I'm not putting you in a bad spot. It's already been passed 390 people, Democrats and Republicans who hold the majority. So this should be an easy lift. When people hear from experts like you, professionals like you, it makes a difference. And every day we'll get someone to call us on the phone and they'll say, what's Congress doing for us? And I always tell them I'm fighting, whether it's healthcare or housing or education or the economy or AI or STEM or technology. But you can't be in a fight by yourself. And so the thing that I say to every organization that comes in here, ask yourself that same question. What am I doing for the area that you asked me to come in here and talk about that's of importance to you? And it does make a difference. And that's the biggest thing I find, that educated and professional folks like you will say, well, I mean, what can I do? I mean, what difference does it make? People win and lose elections by one vote. People win and lose election with a flip of a coin. And it makes a difference. I know when people call me, I had a father this morning to text me, and he said, my daughter is going to be visiting here today. That had been taken off my schedule. What do you think happened? It got put back on my schedule because of that one phone call. If he thought enough to tell me his daughter was coming here and that she wanted to talk about education and the quality of education because she's getting ready to go to college, that one phone call makes a difference for me to change my day. So phone calls work. So I am saying to you, thank you. Thank you for being interested in housing. Thank you for now knowing that the 21st century housing, road to housing, is something that we should all work on because it's one step to get us to the next step. Now, do you have any questions before they give me the hook to go? And you always have to have one question. And see, I brought these two smart people in the back of the room to be able to answer anything that I can answer. Sierra serves with me as the key staffer to the Financial Services Committee, and she is of counsel to me as a lawyer. We have Zandy, who is my legislative director and also of counsel. And then we have Christine over here, who's going to make sure that we capture all of this as our press secretary in the 3rd District. Yes, ma'am.
My question is, you said that it's kind of stalled right now back in the House. What were the changes that the Senate made prior to it coming back to the House that's the real sticking point?
Sarah, you want to take a shot at that?
I think the most controversial is the ban on institutional investors purchasing single family homes. That was added by Senator Warren and Senator Scott towards the end of negotiations, and it was kind of a rushed process after that. And of course, this is a priority for President Trump. He has been since earlier this year asking for some kind of ban to increase the supply of housing. But the provision that was included in the Senate package goes further than what the president asked. And so we have some House Republican members who are struggling with that. So there's a lot of backdoor negotiations going on, but I would say, and there's other stuff. There's a central bank digital currency temporary ban that some House Republicans want to be a permanent ban. But I would say that institutional investor issue is the stage.
Thank you. And a good question. And those are the other things that why I always go back to the people visiting to ask those questions, because then that helps you when you're placing a call. We can take one more. Okay, y'all gonna let me off easy? Oh, there we go. See, I pay them a lot of money, so we want to make sure. I really don't, so I really don't. And I really like them and they're really good. So let's ask one more tough question.
Xavier Arriaga from Enterprise Community Partners. We're also co-chairs of the Home Coalition. So first, want to say thank you so much for your leadership with the Home Partnership Program, being such a strong leader on the authorizing side for so many years before it got into this massive package. And huge step to your colleagues. So we've been working with Sierra on that for a while now. With kind of this contention on these packages, what do you think it's going to take to get to that next step? We keep on hearing aspects of pre-conferencing. We know there is a red line of edits coming from the House, potentially to the Senate. Formal conferencing. What do you think is the next step there to get this package done?
The outside people also weighing in, because every day, as you mentioned, the redlining, we give suggestions, we compromise. You know, I didn't raise Cain about going from 5 to 3, so everybody has to give up something. And that's what you do in relationships. You have to compromise a little bit, but we're not going to go back to what we were before. And we shouldn't have to with 390 people, Democrats and Republicans. And you should applaud that, because this carries over to healthcare, to education. If we, as members of Congress, understand that powerful folks like you are going to stand up and do just what you said. If we take everybody in this room and you make 2 phone calls or 3 phone calls and you say, hey, look, and say it in the words you said. I know you're going back and forth with the redlining because information is powerful. So the first question, if you would call me, if I was on the other side of voting for this, and I said, well, he must know a lot because he just told me, you're 1 of 9. And I'm gonna call you every day because we need this to pass because in my state, and I also know that my state, you represent, or the members on here represent a variety of states, and so do we. So we want information. Then you go to her question. We want to know what are the issues that's holding it up, and when you add a third, and when will you go back and get this through? Because there is a housing issue, and we came to Washington to talk about that issue. It gets people's attention. But when people are silent, it doesn't. That's the only way we got health care. That's the only way we got housing dollars, the home program, and other public housing things, is because we worked with constituents and organizations and people to make a difference. Okay? Well, thank you for allowing me to come, and hopefully I was able to talk something to make you think and keep the fight up, because housing is so important, not just in Ohio, but across the country. Thank you so much. Thank you for allowing me.
Well, that was amazing speech, and so we are thrilled to have Representative Dwight Evans join us again for Policy Day. He's joined us every year, and he's a champion on workforce and housing issues. And he, thank you to Trinity and to Jefferson Health for inviting him. So I'll turn it over to you, Congressman.
Good morning. It's absolutely my pleasure to join you. You're right, for the last 10 years I've come. I really appreciate it. And thank Jefferson Health for inviting me. I really appreciate what you're talking about. It is very critical to have this conversation. You have had great speakers from Ohio, from Massachusetts. Both of them are great people. So I share with you in terms of subject, because I sit on the Ways and Means Committee, and I deal with workforce, something that is extremely important, that we must be very conscious of it. If we are to address the most critical issues we have to collectively try to work together to make that difference. And I thank you for having this kind of conversation. And we always will not agree, but the fact is, at least talking to each other is very essential. It makes a huge difference. So we need to talk about housing, as Joyce just described. We need to talk about food, as she talked about. All of them are interconnected. Food, housing, all of them are interconnected. And to attempt to, what I call, to break them with the poverty buster, is the fact that all these issues have impact on our situations in our various communities. And I'm in the state of Pennsylvania. As Joyce says, she's in the state of Ohio. She's my neighbor. So I share with you that we work together. And I sit on Ways and Means with Workforce. Danny Davis is the leader of that particular subcommittee. We have Workforce. And Workforce is very essential that we need to know, because people do need jobs and opportunities. That is something that we should not take lightly. So I share with you that what I hope to discuss is just the aspect, how do we deal with those things? And we deal by having these kind of conversations. And the reason I've come for the last 10 years to be a part of these conversations, because in my view, only through these conversations can we come up with solutions that are extremely important. So I say to you that we need to keep talking and we need to keep pushing to make a difference. And the only way that will happen unless people are engaged in the conversation, like talking about workforce, like talking about housing, like talking about food as medicine. All of those things make up a way that we try to come up with solutions to these challenges. They will not be dealt with overnight, but they will be dealt with when we work together. That is important to recognize. We must have the commitment of working together to make a difference. So I share with you when we talk about workforce and what workforce means, and we talk about housing, talk about food, all those things are all connected. And they don't just happen, they happen by us working together. That is especially very important. And I really sincerely thank you for inviting me to be a part of these customers for this last decade. I appreciate that you're willing to give me a chance right from the city of Philadelphia and the Commonwealth of Pennsylvania to try to make a difference. How do we affect our workforce thing? How do we affect our job situation? How do we ensure that people are participating? And it is only through people full participation that we can make a difference in terms of outcome. So I encourage you to stay at it, to work at it. As John Lewis used to say to me, and he was on the Ways and Means Committee, he used to always talk about, let's go out and make some good effort. So I say to you that I always remember what John Lewis said. So I'm stressing to you today that that's what we have to do. We have to be relentless. We have to be nonstop to make that difference. And I say to you, it will only come when we work together. That is the most important thing. It's not like it's partisan on food or housing. It's really not. Or crime. It's people working together that makes a difference. And I thank you for coming together and what you have done over this last decade. So you have been relentless. You may not always get what you want when you want it, but you need to stay at it. That is the most important aspect, that you consistently stay working at it. So I say to you, that's something that I want to do. Now, unfortunately, this will be my last term in Congress, and I have enjoyed the time that I've been here and the things that I've done. So I say to you that we got to keep at it. You know, I was fortunate enough to be in the state legislature for 36 years. And so I've been around a little while. And legislated for 36 years, in Congress for 10 years. And in those years, I think I've always been trying to focus on the importance about dealing with the needs of people. That is the most important thing to me, is how do we enhance the opportunity for people? How do we make their conditions? How do we deal with the poverty busters that we have today? And we still have some challenges, but we can't give up hope and opportunity. And it is important that we always try to find ways to address the challenges that we have. So it's not something that's going to be done overnight, but it's going to be that we must be relentless. We must not give up. We must always find a way to make a difference. So I stress with you, I really do appreciate that you have invited me over these years and I've been involved. This has been very personally rewarding for me to be involved in these discussions. And I will always be remembering for you. You are the anchor to the efforts that we have. We need to keep that message going over and over again. Again, I want to thank you for giving me this opportunity, and thank you for having me come before you. Thank you very much.
Thank you so much, Representative.
All right, so you always have to be a little flexible with the schedules of members of Congress. So we'll go back to the beginning now. But I think what Representative Joyce Beatty said is really important about the importance of one or two calls. And over the last 8 years, you all, as members of HAN, have done more than 600 meetings with congressional offices. And that has led to real funding increases, real program improvements, including two big wins last year with the enactment of the Jobs Act and key provisions of the Low-Income Housing Tax Credit Program. And that is the track record HAN members have built together and really why your presence here today matters. And I think what you heard from the representatives is there's another bill that's really on the precipice of passing, and we all have an important role to play in helping get it across the finish line. So you all, of course, are fighting for critical healthcare priorities, including defending the Medicaid program. That work is hard, and it remains an essential battle to ensure your organizations remain financially healthy to serve your communities. And yet, at the same time, so many of you have shown up today in person, virtually, to really advocate for these other issues. And that says everything about your commitment of your organizations to the holistic health and well-being of your communities and the strength of your network, So some of you who are unfamiliar with our work on the call may wonder, why would health systems put their voice behind issues like affordable housing and workforce training? And I think the answer is straightforward. Healthcare anchor institutions understand the vital role federal programs play in building healthy communities. Stable housing and access to good jobs are foundational to health. And they're also foundational to a stable, well-trained workforce that all of your organizations rely on. And we heard that from Representative Jim McGovern in terms of how all of these issues are interconnected. HAN, the Healthcare Anchor Network, we exist to align hospitals nationwide around a shared vision and practical framework for advancing economic inclusion and strengthening local economies to create healthy, thriving communities. And HAN is premised on the idea that by working at the intersection of mission alignment and good business practices, health systems can meaningfully address economic inequities, build community wealth, and improve health outcomes. We help our members, you all, become less siloed organizations so you can more effectively leverage your existing assets to improve community health. And one of those most powerful of these assets is your voice as large community-rooted employers. So that brings us to today. And I think we heard a lot from the members of Congress already. I also want to thank the HAN staff, and in particular our policy team, Bikha Pham and Sandra Contreras. This kind of event takes tremendous planning, hard work, and flexibility, and they deliver it exceptionally well. I also want to recognize our Policy Day institutional co-sponsor, Advent Health. Their commitment to advocacy at this level reflects exactly the kind of leadership this network is built on. They have been supporting this event year in and year out, and we're deeply grateful for that support. And I'd also like to thank the Catholic Health Association of the US and America's Essential Hospitals for their continued partnership. It's really been a wonderful collaboration between associations of healthcare members, and we look forward to continuing it. And we're thrilled to have so many HAN systems participating, with 33 health systems represented today. Those systems collectively represent more than 1,000 hospitals across 46 states plus DC, and HAN members have appointments with about 100 congressional offices today. So we look forward to bumping that number from 600, 700, and continuing the impactful work you are all doing. The late Senator Bobby Kennedy said, "The future is not a gift, it is an achievement." Right. A healthy future for our communities is not something that will simply arrive. It has to be built policy by policy, investment by investment. And you are all doing that work locally. We've heard the stories, we capture them in the Healthcare Anchor Network. And you're here to make the case for the federal government continuing to do its part as well. Our anchor mission framework includes a focus at the systems and sector level. including federal policy advocacy to address the non-medical drivers of health. Lack of affordable housing continues to top community health needs assessments across the country, and workforce shortages remain a serious operational and financial challenge for health systems. At the very moment when community members are eager for training that leads to good jobs with real career pathways. So an important part of HAN member systems voice on these issues is that you are active as part of the solution and not just advocates for it. So as you head into your meetings with congressional offices, we encourage you to emphasize 3 key points. First, that HAN member systems are helping address these issues locally. Affordable housing is the primary focus of their place-based investing strategies. Members are also providing housing deposit grants, homeless prevention funding, and other direct community supports. Second, HAN member systems are building local workforce pathways outside in and inside out. Our members are implementing impact hiring programs and promoting skill development, access to good jobs, and upward mobility for low-wage workers. And third, the return on investment is real, and federal support multiplies it. For every dollar invested in housing initiatives, there is a social return of $1.30 to $1.92. For apprenticeships, employers realize about $1.44 in benefits for every dollar invested. The ROIs demonstrate the benefits for residents, health systems, and taxpayers alike. So healthcare is showing that it's part of the solution, but it cannot do it alone. And so today's goals are to educate policy members on the connection between economic conditions and health and well-being, elevate our role as locally rooted institutions committed to our community's long-term well-being and the need for an effective federal partner, and to demonstrate the Healthcare Anchor Network's collective voice and our capacity for shared advocacy. We have a strong agenda that we are well into at this point, including remarks from members of Congress. We've heard from many of them. Unfortunately, Congressman Mike Flood sends his regrets this morning. As Joyce Beatty said, he's been an important champion for the housing bill. We were glad to have him on the agenda, and sorry he couldn't make it. And we also will hear from, we have a video from one other member that we may show depending on timing. But what we've built together over these years is genuinely uncommon. And I don't know I did that. There we go. And so most sectors do not show up in Washington to advocate for the upstream conditions that affect community health. And I believe that you're all doing that because the people in this room understand that the hospital is not just a building where sick people go. It is an anchor institution with the power to shape the economic and social conditions of an entire community. And together we are building a future where hospitals aren't just places of healing, but powerful partners in creating strong local economies that generate opportunity and well-being for all. Healthcare is showing it is part of the solution locally and nationally, but it cannot do this work alone. The federal government must be a committed partner to resourcing and incentivizing local organizations and your institutions to act and partner together more effectively. So I just want to thank you all for being extraordinary leaders, for being here today, whether you're here in person or here on Zoom with us, and let's get to work. So I'm going to invite up Bikha Pham, our Senior Director of Comms and Policy, to take us through the rest of the agenda. Thank you.
Great, thanks so much, Dave. And we are gonna switch to the housing priorities. Ask Jeff and Xavier to come up to the table here. So most of you have probably heard over the years how much Enterprise and Business Leaders United have been such key organizations to support our work. They are the experts in this area, and we are always, turning to them and saying, "Hey, what happened to that, in that committee?" Or is now the time when we should be contacting key members, and who are they? And then we reach out to you all and say, "Hey, can you ping Representative Floyd's staffers and see where things are?" So it's been amazing. And I just want to first invite up Xavier, who Arriaga, who has been amazing with working particularly with Sandra Contreras, who's our housing lead on this issue.
Thanks, Big Con. Thanks, Senator. Oh, sorry. For inviting me to speak on behalf of Enterprise Community Partners, and thank y'all for being consistent partners on the housing affordability space. I think y'all have seen this stat, and I think every single year it becomes even more and more alarming as we continue to go on. 12.1 million renter households nationwide pay more than half the rent towards their monthly income, being severely cost burden. It's a number that we keep on getting from the Harvard Joint Center of Housing Studies, and it continues to go up. And we have a severe shortage of affordable housing nationwide as well. I think one stat that's not here is a severe shortage of rental assistance nationwide as well. Out of all the folks who are eligible for rental assistance due to the base rental assistance, public housing, et cetera, only a quarter are able to receive it. Even less are able to get into that housing as a result. So we are at a time of a affordable housing crisis, a homelessness crisis, a renter housing crisis, all of that. So I was going to give a kind of brief state of play of what's happening all in Congress. Unfortunately, Joyce Beatty took all my talking points beforehand, so I'm going to go through those very quickly. Very thankful for the Congresswoman for joining. She's been a consistent champion for affordable housing programs from the very beginning, especially when it comes to the Home Investment Partnership Program. So that was great to see, and great to hear her speak. But, you know, like Congressman Joyce Beatty said, we're working with two kind of broad housing packages at the moment. In the House, we have the Housing in the 21st Century package, a historic bill. For the first time in a decade, the House Financial Services was able to pass this comprehensive bipartisan housing community development bill through their committee. Has a ton of legislation that we really appreciate, an overwhelming 309 vote in the House as well, where we don't see that very often, especially in this Congress with this administration. Through a couple iterations, the Senate developed their Road to Housing bill. They took what the House sent to them to the Housing in the 21st Century bill, combined those two, and created the 21st Century Road to Housing Act, which we believe creates a fair and good combination of what those two chambers wanted to do with affordable housing and community development specifically. And again, an overwhelming 89-10 vote. If you're tracking any votes on Congress, you don't see this. Vance is usually stepping up to cut the tiebreaker very often in these circumstances and these days. So we're really excited. Housing has not gotten this attention in a very, very long time, and it's very timely right now. There's some criticism like, oh, there's not enough investments to these bills. But what these bills do is eliminate red tape, streamline regulations, and unlocks capital for those programs to go significantly farther. So would we love to see money here? Of course. But there's always time to advocate for that. We're really excited for these two particular packages. Real quickly, I think the big thing here for us is what's happening with the Home Investment Partnership Program, and really it taking a flagship for both of these packages. So both bills combine what Representative Joyce Beatty and Senator Catherine Cortez Masto have introduced for years through the Home Investment Partnership Reauthorization and Modernization Bill, and the efforts through Representative Flood and Representative Emmanuel Cleaver, combining to make critical updates to the program that has not been seen for over 3 decades since the program was first enacted. There are some minor differences between both bills, primarily the exclusion of environmental language and procurement in regards to Build America, Buy America. But we think we still have a very good amount of wins in the 21st Century Road to Housing bill that we're really excited for. A couple of other priorities that I'd be remiss to not mention that were in this conversation is streamlining USDA rural housing programs, the Reform and Disaster Recovery Act as well, which will permanently authorize the Community Development Block Grant Disaster Recovery Program. Those two bills are in the 21st Century Road bill. We're hoping that any compromise or any conferencing will lead to these bills to continue to make it to the finish line. One huge bill that Representative Joyce Beatty mentioned as well that's inside both of these packages is the Community Investment and Prosperity Act, which she said will increase the public welfare investment cap from 15% to 20%, which is huge for community infrastructure, for our enterprise purpose, for affordable housing. Last time we got this significant amount of increase, we unlocked billions of dollars for the low-income housing tax credit, and many financial institutions are very close to their current cap of 15%. increasing to 20% is going to drive a lot of community infrastructure and affordable housing for the future, for sure. This is kind of a good summary of what's included in the 21st Century Road to Housing Act specifically. But just kind of going a little bit further, President's budget request came out earlier this week. I have some broad talking notes about how this is a better President's budget request, and I say that specifically for housing and community development programs. For my mental health, I only read those sections. So I do believe that this is a bit better of a bill, still a little rough to bear. It eliminates major grant programs like the Home Investment Partnership Program. It also eliminates core programs I know folks care about, like the Community Development Financial Institutions Program, limiting a lot of those core programs, CBG fund as well. Also proposes time limits and work requirements for rental assistance programs broadly. Very similar proposal, a little bit better. And I think with that, we know that Congress reacted to this similar proposal in a way that rejected many of these significant cuts in language proposals that would harm the system significantly. So we're hoping that we believe that's going to be the case again this year, at least for housing. I know this is some past updates that we provided before, but just on homelessness program updates, just wanted to flag for folks that HUD released a new NOFO on the continuum care back in November that will significantly shrink the amount of funding that will be allowed to go for permanent supportive housing. Right now, that notice of funding opportunity is under litigation. They had to release a notice of funding opportunity. It's kind of going in regular order for FY26 due to Congress, adding additional, sorry for FY25. Congress added additional language to initiate some additional guardrails. This is all kind of a work in progress right now, but I know this is something that's in folks' radar when it comes to permanent supportive housing. Let's, getting right into the home program. I think why do we talk about home? It is the largest federal block grant program exclusively dedicated to affordable housing since its inception in 1990. It has led to the development of 1.4 million affordable homes. And that is a stat that also gets, folks talking, okay, it's been around since the 90s. It gets billions of dollars every year. Why are we celebrating 1.4 million homes? Affordable housing takes a very long time. Not only does home does this for affordable housing development, it also does rental preservation. It encourages home ownership. This is a significant record of achievement for this program exclusively dedicated for affordable housing. Last year, the program was subject to to eliminate in the president's budget requests, was also proposed to be eliminated in the House bill as well. Thankfully, both the Senate and the final bill included $1.25 billion of level funding for the program. This year, the Home Coalition, our partner, they're asking for $1.5 billion for the program, a very high watermark for the program, still within the last decade. And one that we think is sufficiently ambitious. One of the big achievements that we're very thankful to work with Representative Joyce Beatty is we do a Dear Colleague letter encouraging support across the House to support this request for $1.5 billion. For the first time since FY18, we got a Republican Dear Colleague signer onto that letter. So we're seeing a significant amount of bipartisan attention to this program. And we do believe that $1.5 billion is possible this year. Another big ask that we heard from Joyce Beatty is passing some form of comprehensive housing community development package. We see that the 21st Century Road to Housing bill is right there at the finish line. It has a lot of the provisions that we really, really like, that would be very influential to the affordable housing development space and just the public welfare investment space in general. We know that there's some things to work out there when it comes to institutional investors and getting towards that finish line. We still believe the 21st Century Road to Housing bill is the way for us to get these investments, and we're going to have another bite at the apple. We believe we could get Congress to talk about housing community development again. So we are urging the swift passage of the 21st Century Road to Housing bill. This is more of a legacy ask, but we still remain committed to the low-income housing tax credit. The One Big Beautiful Bill Act included two major provisions for the Affordable Housing Credit Improvement Act. We are still working to get almost a dozen more provisions in the future enacted. That's something that's going to be coming down the pipeline as well. So went through that a bit quickly. I know we're going quickly through time. If any folks have any questions for me, feel free to ask afterwards. Thank you so much.
Now or after? No. I'm just curious, I know we had in our notes, the home letter and the house is closed, obviously, but I think the Senate letter was closing this week. Do we have any updates?
The Senate closed, the letter did close this Monday. We do not have an update just yet. I think there's a lot of like time crunching with folks submitting their committee deadlines. So hopefully I can get that to y'all very soon, but no updates just yet.
Xavier, it's nice to meet you. When I began in this work, I was in the housing space, and we always said we have to get folks housed and then get folks jobs. So these are two issues that are linked. So I'm going to chat with you a little bit about Han's workforce development priorities for this year. My name is Jeff. I'm with the National Skills Coalition, or Business Leaders United, which is the org's employer engagement arm. So when we talk about good jobs, one of the key investments is registered apprenticeships. What we would like to see for this year is to modernize registered apprenticeships and increase investments in registered apprenticeships. We want to remove the barriers that employers face with engaging in the program, boost the funding, and align the program more with the larger workforce priorities. Now, the Trump administration has called for 1 million active apprentices each year. We're at about 700K at this point. That's not an increase, or that's not a number that's based on any specific action by the administration. That is the typical amount that we have now. So we want to close that gap. However, to get there, this is the third time I'm going to say it, we need to increase funds for registered apprenticeships and invest in pre-apprenticeships and youth apprenticeship. Now take a picture of this slide here, or write down the info here. This is the kind of info that members of Congress want to know. So registered apprenticeship is great because a lot of folks that exit have a job, they retain a job, they earn a great wage, and it's great for employers too. So it's $1.44 of a benefit for an employer for every buck that they invest. In the healthcare industry specifically, there are a range of different jobs that people can earn through a registered apprenticeship. You want to take a picture of that as well in case a member of Congress asks. But generally, I would say it's this info here that folks want to know. They want to know what the return on investment is if we are going to spend public funds in this. All right, so apprenticeship is really important because individuals earn a wage as they get new skills for a good job. That is key. A lot of times, folks have to work a full-time job and then go to class around that job. If you have kids, that's really hard. However, with apprenticeship, you are on a track to a good job and you earn a wage at the same time. On the business side, apprenticeships are more likely to stay with the job where they got the apprenticeship from, which reduces the retention costs. And of course, it strengthens the local workforce pathways. The other big thing that is an issue up here on the Hill now is the training that we invest in aligned with employer needs? Apprenticeships are right in there because folks are going to get trained on the job. So these are going to be skills that are very much aligned with employer needs. Now, pre-apprenticeships are kind of like an on-ramp to apprenticeships. In some ways, you can get a credential with the apprenticeship, but they provide you with those basic skills to go into a registered apprenticeship. This is a way to get into the field, a way to get into a good job. So this is also a really important investment to make around the apprenticeship program. And Han has put together a list of some existing pre-apprenticeship programs from folks in the network. Any questions about apprenticeships before I go on to WIOA?
Can you just go back to that one slide and take a picture of that?
There you go. All right, everyone. 5, 4, 3, 2, 1. Moving on. All right. So WIOA really has created the backbone of the workforce development system here. Do any of you work with or know of your local workforce development board? Might have a different name, but this is generally the program that funds that. It's big. There's a range of pots of funds within this program. It needs to be reauthorized. It has not been reauthorized for about 10 years at this point, as we all know. Things have changed a lot in the past 10 years. Now, at the end of 2024, there was a bipartisan agreement. And when I say the end, I mean the very end. And so essentially, both sides said, let's pass this bill, a Stronger Workforce for America Act, but they ran out of time. So they cannot pass that bill. Now, that bill has been reintroduced in the House side, but it is no longer a bipartisan bill, and I'll explain that at the end. So what we like about this bill is that 50% of funds have to go to train folks, and 10% have to go to those supports like child care. A minimum of $5,000 goes towards training for per dislocated worker until the funding runs out. It codifies programs for those who are justice involved in industry sector partnerships. And it adds some flexibility to funds to go more towards upskilling folks who are in a job and want to grow in the job that they have, and industry sector partnerships too. Now, those things sound great, right? The backdrop of all of this is the funding. So the United States spends close to last in industrialized countries in workforce programs. This increase of how you can use funds is great. The floor that it's about $5,000 that folks can access to get trained is great, except when the pie is this big and you don't increase funding every year with inflation, the pie shrinks. And because of that, if you want to do something cool on this side, well, you got to take the money from this side. And the money from this side is really important. So this program needs more funds. The other thing is there's a move to consolidate a lot of the funding streams under this bill, which again, it sounds great. However, does anyone remember welfare reform of '96? So in that, they took the program, they turned it into a block grant, and they did what with the money? They cut the money. So what we're afraid of here is when you put it into a block grant, that does mean that states are able to do some more interesting things with the funding. But if they cut funds, the pie is small to begin with. So we are trying to avoid a consolidation, or at least a block grant, to combat those funds. Now, the reason why the bill is no longer bipartisan is because the administration wants to cut the Department of Ed, eliminate it as much as they can. So what that means is some of the programs that are in WIOA need to move. And so the bill would codify to a certain extent that elimination of the Department of Ed, which the Dems do not like. So the Dems are not going to support this bill. It needs 60 votes on the Senate side to pass. The Republicans do not have that amount of votes. So at this point, there are things in the bill that we like. There's big things that we do not like, but the chances of passing right now are pretty small. Any questions about WIOA?
What is the reauthorization timeline? Is this something that realistically we could do in the next Congress?
Yeah. So this is an issue that folks want to pass. This is maybe a bit of a messaging bill at the moment because of the election in the fall. However, this is something that both sides want to pass. And we do expect to see a bill in the next Congress come up that could pass. And so it is extremely important to talk about the importance of reauthorizing the program, maybe not just this bill specifically.
Thank you both so much. Really, I appreciate it. And so we're now going to have our two HON members. Oh, I'm sorry, Maggie. Okay, okay, great. So now we'll ask our two HON member speakers to come up, Maggie and Tavinder, and we'll start with Maggie at the podium here. And so Maggie has been a Aligning to Advance Policy Initiative Group co-chair and just a real power player person for us in terms of the turning out the Trinity team for Policy Day, for the congressional meetings, and now all the congressional speakers as well. I think you guys hit all those, so I just really appreciate your time.
Great, so good morning. I'm here to talk about Trinity Health and the work we've done in partnership with HON since 2016. So am I advancing?
Oh, yeah. So,
oh, right. Okay, yeah. Great. All right. Hold that one for me. Okay, so Trinity Health, if you're not familiar, we are one of the largest Catholic health systems in the country. We span 23 states, and we're based in Michigan. But we talk about how Trinity Health really expands the entire care continuum. So we have 90 plus acute care hospitals, but we also have a really strong presence in continuing care. So we have nursing homes. We're actually the largest nonprofit provider of the PACE program. If you're not familiar with the PACE program, get familiar before you turn 55, because it's how we should all want to age as we get older. But anyways, so we really span the whole care continuum, but we are really based in our mission as a faith-based organization, and HON aligns very well with our mission, hence why we were one of the founding organizations in 2016 of HON, and we've tried to be strong partners with them since, whether it's participating in Policy Day, whether it's working on in various subcommittees that we have, and signing on to our various hiring and sourcing all the various pledges that we have. So just a little bit of background. And then affordable housing. So our investing program actually dates back. We've been investing in over 20 years. And we actually found a loan that dated back. We did some research before and found a loan that dated back into 1997. But we say usually it's been about 20 years since we've had our formal investing program. And I think it's really unique to talk about this for hospitals, because this is not something that, like, when you go in to talk to even a healthcare staffer or anyone, they think, why is a hospital doing low interest loans? Like, why are they investing in affordable housing or other workforce programs and the like? And that for us, it's based in the Han mission, but also Trinity Health mission, that we know that we have to go beyond the walls of the hospital. And so affordable housing, as we are talking about today, is really, really directly connected to health outcomes. So our investing program, for the most part, we invest in CDFIs, which we've heard some about today. These are organizations that really are the leaders when it comes to this type of investing. And we provide loans to them that help build the capital stack to actually get programs off the ground. And so this has been, for Trinity Health, our portfolio of loans has been up to 75 million that we invest. And 2/3 of that has generally been affordable housing projects. So that really seems to be, that's some of the projects that are easier to get off the ground. They're also easier to see those returns on investment. And you can see a couple here, but I'll share a little bit more detail. And then when you look at our CDFI partners, about half of the CDFI partners are investing in affordable housing projects. So this is clearly a big focus for the investments that we're making. So this is a couple pictures of some of our projects, and I lobby on a lot of things, Medicaid, especially these days, but these are the stories that I like to tell the best because it's just like so unique and cool. So we have a ministry, actually our only FQHC across our whole system in Atlanta, Georgia. It's called Mercy Care. And we have this project that now has been going on for at least 5 years. It's now in stage 2 because it's been such a successful project. McCauley Station, and it's right by our FQHC, and we're building this. We've already built one affordable housing, and then we also have a senior focused affordable housing project there. This picture on the bottom that you can see, this is in Columbus, Ohio. It's called Vista Village, and it's tiny houses, and their focus there is on transitional housing for the homeless population. So once they're getting care at our Mount Carmel Hospital, then, obviously we don't want to just send people off into the world who don't have homes. So these can actually serve as a place for them to go and recover and help them find more permanent housing. And then, yes, we have Uptown Flats. This Uptown Flats program in Pittsburgh, which is also a very cool, unique ministry of ours, is a community behavioral health center. And they do way more beyond that. But Uptown Flats actually connected directly to the work that we're talking about today. The home program is, we've got about, I think it's $3.4 million of home funding that support this Uptown Flats project in Pittsburgh. So directly related to the work that we're talking about today. And then if we go on to, so we started doing, in 2022, we started doing what we call our partner census. And so this gives us a little bit of direct insight into the return on investment that we're actually having with these loans. And so we asked all of our partners that we loan with, that we loan to, what they're doing with the money. And then we actually have quantified it. And so since 2018, when we started doing this, the quantifying, we built over close to 16,000 units of affordable housing using the funding that Trinity Health has loaned. We've got over 1,000 childcare slots, and then real estate. We have 3 programs that we've actually directly invested in loan programs. So at some of the partner colleges, especially community colleges in some of our ministries, and then created over almost 13,000 jobs through this program. So we think that's we want to be able to show that, we want to be able to talk to our leaders and say, we're actually having an impact here, and on the affordable housing side, especially. So then if we go on to workforce, we could talk all day about the workforce challenges in healthcare. It's a problem, 60% of our budgets are spent on labor costs, and we would not be able to do what we do without our workforce. And so that goes from the top, our physicians and our nurses, all the way down to the allied health specialists, and then the folks on the ground who are really the ones interacting with patients, whether it's through environmental services, food and nutrition. And so we are trying to think about ways where we can, one, keep those people who we already employ within the Trinity Health family, and then how do we also reach out to the community and bring those folks into our hospitals and our broader ministry, because we know we need healthcare workers. And so we've really focused, we're actually building out our workforce development team. We've piloted a lot of this work in our Michigan market, which is where we're headquartered, but we're building that out into other states across our footprint. We talked about I think someone else mentioned this today, this outside in and inside out strategy. And really that's been our focus, is we want to be able to take that food and nutrition worker We know, first of all, we know that that's one of the highest turnover jobs in our whole ministry is those people who are delivering the trays every day to the patients or the folks who are coming in and cleaning up their rooms in environmental services. And so how do we bring people into those roles because we have that high turnover? But then also, how do we talk to those folks and say, you might not want to be delivering trays for the rest of your career. What can we do? What are you interested in the hospital that may be something that we can help you train up for? So maybe it's they want to be a surgical tech and we can get them registered into some sort of apprenticeship program. But we have a lot of career counseling and training that we have within Trinity Health to help support people as they move through their career. And so specifically, the picture here, we recently have rolled out a medical assistant apprenticeship program in Iowa. But in terms of most of our registered apprenticeship programs, they've been in Michigan. The medical assistant program has been our biggest and most successful. You can see some numbers here of folks that we've hired since then. 154 apprentices that we've actually been able to hire in that Michigan market. We have 15 current apprenticeships right now. But I want to make a pitch here, I guess, on when we're talking about with offices today about why apprenticeships are so important and the modernization, as Jeff mentioned. So we previously had 2 registered apprenticeships, and one was for health information management, so on the clinical documentation, coding, that type of stuff. And then we had to end both of those, partly for funding reasons, but also because we were only hiring like one person in, and it didn't really make sense. But the sterile processing tech was the key one here, and we actually had to end that because it took the requirements for registered apprenticeships were so burdensome. We can train a surgical tech in about 6 to 9 months, which that's great. That's someone can in half a year they can be into a job, a good paying job, but the Department of Labor requirements require basically like a year minimum for that type of apprenticeship. And so why would someone go through a registered apprenticeship program when 6 months, they could have had a job 6 months ago? And so it's these type of barriers that have prevented us from maintaining these apprenticeship programs that we desperately need. So I think that's something that we really can focus on today is these, the requirements from Department of Labor right now are preventing us from expanding these apprenticeship programs. And, I think a lot of folks on the Hill, they think of apprenticeships in construction and, a lot of the trades and stuff like that. Healthcare is not where people's minds like immediately go to. And that we need to educate people on that because as we've talked about, just the workforce challenges are just so huge. So that's it. Nice.
Thank you for that. Was so interesting to hear about and impressive work. So kudos to you and Trinity and all the work you're doing nationwide. So yes, I'm Devinder Fall. I'm from Mass General Brigham. And I just want to say thank you to Han and the members of Congress and all my colleagues here, and of course online for the opportunity to present to you today. My heart is young, but my eyes are old. So unfortunately I have to wear glasses. So I can't, everybody's a little bit blurry, but hopefully this will go okay. So similarly to what we saw with Trinity, I just want to orient you a little bit to Mass General Brigham. So we're a large healthcare system in Massachusetts and a little bit in New Hampshire. We have acute and specialty hospitals across the state, including our founding hospitals, Mass General Hospital and the Brigham. We have 5 Harvard-affiliated teaching hospitals, our own health plan, and operated about approximately $23 billion in operating revenue and a little under $3 billion in research funds. We are one of, if not the largest employer in Massachusetts, and we take that responsibility very seriously. We are intentionally leveraging our scale and our size, not just to deliver on care, but to drive outcomes in terms of economic mobility and community stability. That means that we are aligning levers that we control, including how we hire, how we invest in capital, and how we partner with communities. Our focus is actually really simple. It's to improve health outcomes through targeted clinical community interventions by addressing the underlying drivers of health and poor health outcomes. So as we've been doing today, I'm going to focus on some of the work that we're doing around workforce development and housing stability, but to just say it at the outset, all of this work, and we work well beyond these two areas, is not about charity. It's really about creating an infrastructure for better health outcomes of the future. So I'm going to start with workforce development, and I'm going to tackle two areas. We actually work in sort of the youth space as well as the adult space. So as we've already heard, there are fundamental workforce challenges that we're all really grappling with. And we're really kind of grappling in a critical shortage around entry and mid-level healthcare roles. At the same time, what we find with our community residents is that we serve is that there are really not clear pathways into these careers for the residents of our communities. So at Mass General Brigham, we're really working to address both with a pipeline model that starts early and leads directly to employment. So for the youth in the communities we serve, and you can see a couple of pictures here, our partnership specifically with the Boston Public Schools and a specific partnership with the Edward M. Kennedy Academy really creates early exposure to healthcare. You can see in that top photo there, those are a couple of our students, EMK students, who are in immersive experience, getting really hands-on in the institution experiences that are so valuable. Our partnership also provides pathways for achieving industry credentials while in our program. So doing that, we've sort of talked before about, having to take time off or do things at all different times of the day to sort of like learn and to earn. So this is really an opportunity to ensure that our students who are in high school are graduating with industry credentials and also real experience that will service them post-graduation. I think this graduate at the bottom really kind of is excited about that part of it. So with our youth programs, the bottom line is really about building a workforce pipeline that starts in high school and leads directly into jobs. In the adult space, both for community members as well as our incumbent workers, we are scaling our work in paid earn and learn apprenticeships. These programs really allow individuals to get paid while gaining credentials and then transition directly into full-time roles. We are starting with some of the high demand roles that we see in our area around medical assistants, surgical techs, and phlebotomists. And importantly, we're reducing, in addition to doing the earn and learn, we're reducing barriers to succeeding in these programs by aligning that education and training with social support services. Really thinking that at the end of the day, people shouldn't have to choose between earning and learning. We're making both possible. In the housing space, so we've been talking about it all morning. We know that housing stability is one of the strongest predictors of poor health outcomes, chronic stress leading to physiological harm, disruptions in healthcare access, direct exposure to unhealthy environments, economic trade-offs, having to pay your rent versus something else, and the list goes on and on. What we see in the map on the right-hand side of this slide, which is a map of Boston, is that much of our city are basically housing cost burdened neighborhoods, with the darker shades representing upwards of 50% or more of cost burdened households. In our 2012 citywide community health needs assessment in Boston, housing once again remained a top issue that was prioritized by our community. So at Mass General Brigham, we treat housing as a core health and economic strategy, not as a side issue. Let's see. So through funds that we make available through a determination of need process that's fairly unique to Massachusetts, we're investing $18 million in affordable housing across Boston and North Suffolk County. North Suffolk County is an area just north of Boston proper that also has a couple of communities that are of particular need. Specifically, our investments in these in housing are really focused on housing production and preservation, eviction prevention, and housing policy and systems change. My colleague Maria Rios is here from Government Affairs and wakes up every day thinking about issues around that. So it's important to note that these dollars are catalytic. We heard a bit about the home program and the low-income housing tax credits. These are really kind of as I said, sort of, catalytic dollars that we really hope to kind of leverage to snowball to really tackle issues that are much bigger than even $18 million can solve. And I think the number you had was mind-boggling. So we're all chipping away at it. Xavier, you got to, we'll get there. Bottom line, raising healthcare dollars to stabilize housing, and in doing so, we believe that in the long term, we'll expect to see improvements in population health. To get a little more specific, I just want to give a couple of examples. So the first one is the Boston Acquisition Fund. We were part of the first group of investors to create this fund, and it's a revolving loan fund that's operationalized by the city of Boston. And it's so far, it's fairly in its nascency, has been able to preserve almost 400 units, affordable units, and stabilize nearly 1,000 residents in stabilized housing. The second one is an investment that we made in the city of Chelsea through the neighborhood developers. That's also providing access to low cost capital and has so far preserved 91 affordable units. And then the last one is a partnership with the Dudley Street Neighborhood Initiative, which is a neighborhood of Boston, which advances actually community land trusts and really creates permanent affordable housing in that community. And we really think that all of these investments really ensure the benefit, not just for one generation, but ultimately for many. So really, this is about preserving affordable housing at scale and preventing displacement before it happens. So my last slide, so I think I might actually get us out of here in time so people can go on to the next adventures. So this is just kind of a summary, right? So, one of the most important pieces that makes this work really different from what we've seen before is that, and I'm not speaking to the prior slides, but kind of the history of this work, is really that it's integrated. Across NGB, we act as one. I also want to note that across Boston, we are working more as one with our sister hospitals across the city, with the city health department, community health centers, community-based organizations, and others. We are aligning and coordinating in areas like workforce development, housing stability, and clinical care. And the results, we believe, are fewer barriers to care, better outcomes, and more efficient uses of limited resources, which we've heard much about today and are all, I know, very concerned with. So when healthcare systems act as anchor institutions, we can drive economic mobility, stabilize communities, and improve outcomes at scale. Thank you.
That was such amazing information. Thank you both. And anybody have any questions for them? I know we asked a few already.
I do, but for the sake of time, help me on.
No, you can ask. Go ahead.
Well, thank you for both of those wonderful presentations. I have a question for Taminda first, and that would be around what are the industry recognized credentials that high school students are graduating with in Boston?
That's a great question. So I actually wrote a note because I was like, I think I'm going to get a question about that. So I will say, so I can say at a very high level and certainly provide some more information offline. The three areas for the high school students that we're focused on around health assisting. So, roles like similar to like nursing roles, medical assisting, and then just generally roles in biotech. I'm happy to offline provide you more information specifically about what those the training and education certificates that are being offered. But it's something that we've rolled out through our partnership with the Edward M. Kennedy School, and we're really excited about those.
Thank you. Awesome. And then for both of you, and you've got it on this slide, I'm curious to know, how do you work with either nonprofits or your local government to really figure out what are the high need, highly connected communities that you may or may not be doing extra work in to make sure that you're recruiting workforce from there?
I can start, and I'm just gonna also, I'll start, but I'm also pointing out my colleague Lil, who works in our Mid-Atlantic region, and this is what she does every day, so she probably can speak better to this, but I'll just, as from a system level, one thing at Trinity Health, we have over the past 6 years plus, by the end of this year, we will have our entire health system will be on some version or on the same version of Epic, which is a medical record. And so you will be able to you might be getting a care up in Pittsburgh and in Philly, where Lil is, and then you could go down to our hospital in Fort Lauderdale for the winter, and you'd be able to have your medical records seamlessly connected. But the cool thing about that is through our medical record, we screen for social needs. And we screen all of our patients at the primary care setting and our acute care settings to ask questions about access to food, access to housing, financial needs. And we have, through that, we've actually been working with the University of Pennsylvania. We have like one of the biggest databases in the country when it comes to social needs. And so we use that data and because it's incorporated into our medical records, our physicians and nurses at the bedside or at the primary care setting can actually give like prescriptions and can say, okay, you need affordable housing. Let me connect you directly to a housing provider in our community. And so I'll just, I don't know, put Lil on the spot if she has anything she wants to say about how that actually works in practice. But
Yeah, and as soon as that referral comes, it goes straight to community health wellbeing department, and so they're picking up worker or someone in the department that make sure that they connect, because we all know that individuals, if they don't trust, then they're not going to do anything. The other part that we know is that you can go see a patient and give them a phone number, but that's not going at all. And so what we're pushing in Mid-Atlantic is making sure we almost walk them through the resources. And so we're doing a project in Delaware, St. Francis called Healthy Village, where we took underutilized space in the hospital and invited partners to be there on site. That has been huge, especially in the homeless population and with substance use disorders. So making sure, of course, readmissions is effective, gets effective with, especially with homeless and substance use. So we're seeing that having someone immediately, as soon as we see that on Epic, we get notified, and then the resource partner also gets notified.
And I think the key to that is that we have that closed loop. So we can refer someone to services, and if to Liz's point, you can send them off with a phone number and say, good luck. And then we have no idea, do they ever actually get access to that service? But now because we have it in our medical record, we can actually say, oh, well, they connected with the community health worker, and then community health worker connected them to the housing. And it's all the goal is to be seamless across that whole system. And so, that's the goal. Does it always work perfectly? No, but that's certainly where our goal is.
I'll make my comments really quick. So two things. So just around sort of like de-siloing and making sure that we're interconnected. So I'd referenced, we've done the 2025 Community Health Needs Assessment, citywide assessment. That is actually a partnership. We're in our third round of doing it with the city health department at the table, all of the other teaching hospitals in Boston. So the teaching hospitals beyond our own, licensed community health centers, community-based organizations. We do the sort of triennial community health needs assessment process together, and then we actually build basically an action plan, a community health improvement plan, and we stay at the table. And so we will have working groups in each of the areas. Economic mobility is one. So across our city, we're really thinking with the city as well as the other players in the city, like how are we responding to this? And the other thing is that for the housing dollars, I mentioned that we were using this sort of determination of need process that we have. That was $18 million. We have another $15 million that's going into economic mobility. Those are basically community-based grants that have to go outside of our organization into the community to really reinforce and build economic mobility in the communities that are prioritized through the data that we see and where we prioritize based on the needs that are being elevated from communities that we serve. So it really is part of a process that's truly like community driven, community informed. And we're quite intentional then when we think about our partnerships around apprenticeships or our partnerships around youth programs, that really informs where we really try to focus our efforts.
Well, I would just add, one of the biggest challenges is making sure our clinical team understands. So because they're at the bedside, they're seeing, and if they don't understand how we work together, because going to the point of working with all community, that's a job in itself, that you're going to trust each other and work together. So the clinical team is huge
So thank you so much. So really delighted to have my colleague Lauren Worth come and share some exciting news.
Right, good afternoon, everyone. So I am here to tell you about a new resource we're publishing today It's hot off the presses and it's called Creating Economic Opportunity Through Healthcare Career Pathways and Impact Workforce Toolkit. And it collects learnings from Trinity Health and about 30 other health systems in our network that have been making these investments in workforce development as part of their anchor mission. And it is a comprehensive resource that really shows how health systems who are interested in creating these career pathways that turn entry-level jobs into careers, especially for residents who face barriers to employment and career advancement, how to do this work. So it really tells a story of that outside in and inside up strategies that Maggie talked about, and just shows how this work is happening across the country. And we see this as a resource that complements the policy advocacy work we've been hearing about today. So the policy wins that we're focusing on, they would help to make this work a lot easier for the health systems that are trying to do these apprenticeship programs and to create job training programs that would make it more easy to close these shortages and create these sustainable talent pipelines. So we wanted to highlight some of the ways that this work can be done. And we know that there is a real need for this. So as these shortages in healthcare continue, there's straining access, quality of care, sustainability of health systems. So we know that there are a lot of people who are hungry for solutions. And this toolkit has that. So if you check it out, it will have a lot of information about how you can create these programs. And it builds on a lot of learning that we put out in a toolkit in 2016, a long time ago. It was called the Inclusive Local Hiring Toolkit. And this new edition captures a decade plus of learning that we have pulled from conversations with workforce development practitioners at 30 plus health systems. And we had a lot of conversations with people about how they are moving this work forward within their systems and doing these programs that make it easier to ensure that working people and their families, people who are living paycheck to paycheck or below the poverty line, have equal access to quality jobs that can lead to economic stability and thriving. So we are really excited to share this with you and get this out there in the world. And you can go to the, there it is, the QR code there if you want to check it out. It's at impactworkforcetoolkit.healthcareanchor.network. And it has a lot of case studies, tools, tips, talking points, resources, and there is just a lot in there to explore if you are new to this work or you're an experienced practitioner of workforce development, or you're just curious to know more of these stories about how health systems are making these investments. Encourage you checking it out. So if you have more questions, like how are these investments leading to increases in retention, and what sort of opportunities exist for savings from these workforce programs? Yeah, a lot of information in there to find answers to those questions. So check it out and let us know what you think. We would love to hear what you think and any thoughts you have. But yeah, this is a great opportunity to learn more about how health systems are showing up and creating opportunities to expand economic security and thriving. That's it.
So thanks so much, Lauren. I know you did a ton of work on this, and our members also for helping out and really updating the information and doing all the work. So we are at a point now where we're going to talk about 15 minutes about the logistics for those doing congressional meetings. So those of you on the line who are not doing congressional meetings, you're welcome to stay and learn more so that for next year you can join us. But we, as Dave Zuckerman said, we're really excited. We have almost 100, probably have hit 100 congressional meetings this policy day, and a number of our members are also doing meetings on their own after policy day. So that's super exciting as well. You all are probably very familiar with this toolkit at this point. It's just a reminder to that we have a lot of.
It's called Freed and Williams and Connor. I left them a message. They called me back. left me a message. So it's just a matter of getting a hold of them, seeing how much credit we have with them and how much they cost per hour. And then if we decide that we want to pay for an hour consultation with them,
So sorry about that. We have a speaker, I guess it's coming from the building speaker, so that was good. So we have the congressional meeting tips that you've seen before. I think that the thing to keep in mind, especially for those online, is that we've had in the past, some of the staff may not have their videos on, and that just to think of it as a phone call, some of the staff, they're not in a place where they can turn on their videos because of the background. So don't worry, just continue to please go through your talking points and your asks. And there's also Darcy is our Han scheduling consultant, and sometimes the staffer will say, well, is Darcy coming? And you may not remember who Darcy is, so you might go, what? You know, and so just say, no, she's just helps out with the schedules, the meeting, so she won't be joining. We tried to correct the calendar invite situation this year, but it's just too many words to put in the calendar invite that we send to the staffers. So your health system name isn't going to be on their calendar invitation. So they may be like, oh, they realize like we were meeting with Jefferson Health. You know, just be like, okay, it just the name was just too long. They couldn't fit everything in there. So and then we're going to go a little bit to the some of the questions that were asked today about sort of strategy as of this date, and some of the great questions that Congress members responded to were there, as well as our speakers. But you, the one-page summary of the issues that you all received, Sandra and I tried to add in there some of the sort of strategies to think about as of today. And so one of the questions that came up online was about the apprenticeships, like what is asked today? And it is that we want support for funding for the 1 million apprenticeship slots. The thing is that, you know, how with the way politics are, especially today, if you say one person supports it or what it's one person's idea and the representative you're meeting with doesn't like that person or doesn't like, then they may turn off. So I think for us, our suggestion is if you're meeting with Democrats, Democratic congressional members, don't start with the Trump administration proposed this, but just start with apprenticeships are really important, and we would ask you to support funding, ask Congress to support funding for 1 million apprenticeships. It's a bipartisan issue, and it's something the administration has has set as a goal, has, you know, whatever wording that you think will show that it's very politically viable without shutting anybody down. And in terms of the road to housing, you heard it in a lot of details today, but with the Democrats, that almost everybody has voted for the bill in the House and the Senate. So for the Democrats in the House, I think it's the same question that was asked of Representative Beatty, which is, you know, sort of how to finagle all that. And it's really just, we urge you to do what you can to get the bill enacted, to get the compromise secured and move it along. There's a really big housing need. On the Senate side, similarly, have the same type of conversation. Note the 9 Republican senators and 1 Democratic senator that did not vote for the Road to Housing Act. So I know 3 of us are in meetings with those senators, and just I think we've reached out to y'all. But basically, you can skip Road to Housing if you meet with those senators, because that vote's done. And then for the home program, it's really very much it's a difficult situation in the House with the funding that was enacted, the proposal last year, and with the House Republicans, and then with the administration, significant cuts. So I think it's just to emphasize more and more how important the home program is. So Sandra, I'm asking you to come up, and I know you cover a number of the additional.
Oh, sure. So the National Apprenticeship Act, there's no actual bill that's reauthorizing that at this time, right?
That's right. For the National Apprenticeship Act, there hasn't been a bill that's been proposed. Now, one of the things that some of you may have noticed is initially we had thought that the ask could be to introduce it or to support it if it's introduced. But at this point, one of our national groups that we work with just suggested that now is probably not, given everything that's going on with, in Congress and the administration, now is probably not the time to really look at fully reauthorizing that act. That let's wait for a better, more opportune time where we can get a really comprehensive reauthorization, get some of the improvements in there that we really want, including the funding piece. So we're not asking for that at this point. Thanks, Meg.
All right, so if you're here, it's because you have a congressional meeting. And if you have a scheduled congressional meeting, you should have received an email with everything you need to be prepared. You have a personalized meeting agenda. You'll also have calendar invitations from our scheduler on a Google folder with advocacy resources, including the background materials on each member of Congress, and the fact sheets on the issues to support your conversations. With the Leave Behind packet link is, because I know all of you have asked about that, is included in the calendared invitation. If you find that it is not, let me know, reach out to me via email, cell phone, and we'll make sure to get it. Or for staffers, you end up meeting with a staffer who's not on the calendar invitation. Let's just try to make sure that you have that material to give them. So what's in the Leave Behind packet? The Leave Behind packet is designed to reinforce your message and make it easy for staff to follow up. It includes a summary of the housing and workforce development asks, a one-page fact sheet on each ask, a two-page summary of the non-medical drivers of health and the housing and workforce development information, very specific to healthcare, because people in the offices are gonna be like, why are you guys here? So this is that sheet. You also have the HAN Principles for Health and Affordable Housing that show how HAN members are doing this work very intentionally, very committed, and same for workforce development and inclusive local hiring. And so, and we have really juicy, very long documents on affordable housing and workforce development activities that HAN members are doing. So people can find their state and see what y'all are doing to support and reinforce this case. You don't need to cover every document in the meeting, just use these materials strategically to support your conversations. On the day of the meetings, I'll be, sorry, I forgot to advance the slides, but yeah, so just everything I said about the calendar invitations and the folders and what's in the Leave Behind packet. And this here is my phone number, my cell phone, and my email. If you're a Trinity Health staffer, reach out to Maggie. And she's very nice. So she's a great person to reach out to. And I hope I am too. So y'all reach out to me if you have any encounter any last minute changes. We've collected as many cell phone numbers of people who are doing congressional meetings as we could find so that we could reach out to you just in case email was not enough. So if you are meeting with a congressional staffer today and we don't have your cell phone number and you would like a text in the event of a last minute change, please email that to me or text it to me. Okay, now I'm opening it up to questions. Happy to clarify anything related to your meetings, materials, or any other logistics. I'll take a look at the chat too. I see a lot.
Sandra, I don't have a question. I just want to say thank you. We could not do this without all the work that you put in and your team put in. So thank you very much for setting all this up. You guys have put on.
Thank you so much. Thank you so much. So behind the scenes, we also have Giselle Rosado, who's been stepping in to be our policy and communications consultant this half of the year. So thank you, Giselle. And also, we couldn't do anything that we do without Justin Anderson, our operations associate, who just makes everything happen. And of course, I want to thank Vika, who brings all her expertise for many years of doing this type of work. And we can't do any of this without you. So thank you for joining us today, and I'll turn it over to Vika.
that's it. Thanks, everybody. And we have lunch. The brown bag lunches are coming, so thank you.
That concludes the Policy Day online.